Good afternoon, Hattiesburg. Thanks for joining us for this COVID-19 briefing for Wednesday, August 4th. We're going to go over today's numbers, and then we're going to talk about some specific things that came in our conference call this morning with our COVID stakeholders around the community. Today we have 110 people in the hospital who have COVID. That 110 number, yesterday it was 115, so we're down slightly. But yesterday the 115 number was the third highest on a single day since COVID came to our community back last March. But even today, the 110 number is the fifth highest since this pandemic began. Of those 110, 30 right now are in the ICU. And then just some notes about that. Of the 110 hospitalized right now, only 6 were vaccinated. So 94.5% of the people in the hospital are people that were not vaccinated. Of the 30 in the ICU, only 1 was vaccinated. So that's 96.67% of the people in the ICU were unvaccinated. Of the 13 who are currently on ventilators, none were vaccinated. New cases today, Forest County saw 109 new cases. Lamar County reported 107 new cases. Those are single-day reports, and those two combined are the highest single day of new cases in the Hattiesburg metro area since COVID began. Just in the past 7 days, Forest County has seen 600 new cases. Lamar County has seen 465. Now, if you recall, throughout the pandemic, we reported the inside 14-day number, the number of people who were diagnosed within a 14-day period. Now, in the worst parts of this, November, December, January, you saw that inside 14-day number get to 1,200, 1,300, sometimes 1,400. We're seeing 1,065 just in 7 days, in half the amount of time, and that should concern you. Just another statistic we've seen in some public health agencies, the percentage of change in the last 14 days, and that's in cases per 100,000 people. Forest County has seen a 532% increase. That's the second highest in the state among counties. Lamar County, a 367% increase. That's the fifth highest in the state among counties. So this morning we had our weekly conference call. We've had this every Wednesday since last March, and this involves the CEOs of our 3 main healthcare institutions. It involves the health department, emergency management, local elected officials, our school districts, and our universities to all share information. And obviously this morning's call was very eye-opening and very sobering. So I'm just going to give you some statistics from the Hattiesburg Clinic side of things, because obviously they're the main outpatient clinic in our area. Last week, Hattiesburg Clinic had its single highest week of new positive cases reported, with 759. Just to give you some comparison, the other 2 highest weeks since March of 2020 were obviously the week after Christmas, where 605 new cases were reported by Hattiesburg Clinic, and the week after New Year's, where 612 cases were reported by Hattiesburg Clinic. This beat that by well over 100, just to show you the situation that we're in right now, because higher numbers of initial cases reported, and we'll talk about the percentage of those that were vaccinated versus unvaccinated. Those will ultimately end up in the hospital. We also saw the highest number of individuals last week under the age of 20 diagnosed with COVID. Now that was 213. Now those 213, 77 were 0 to 9, and 136 were 10 to 19. Now already this week, just in the 4 days this week, we've already had 112 people under the age of 20 who were diagnosed with COVID, 39 of them being 0 to 9. Now, no one under 20 right now is in the hospital between Merit Health Wesley and Forest General. But what happens is those people can spread that to family members who ultimately might be vulnerable because they are unvaccinated. And speaking of which, of the 759 diagnosed last week in the Hattiesburg Clinic system, 87.48% were unvaccinated. Now, the idea of breakthrough cases, that's a positive coming from someone who has been vaccinated. That number has consistently been between 10 and 13%, which kind of tracks what's happening around the state. But even though they're getting COVID, 10 to 13% of these new cases are unvaccinated individuals. They're having better health outcomes. You're not seeing those translate into hospitalizations and ICU admissions. Some good news, though. Over 1,300 people went to Hattiesburg Clinic last week to get a vaccine, and that's the highest 1-week total since the end of March, beginning of April. And speaking of some other good vaccination news, Forest County's fully vaccinated number now stands at 28%. And another 5% have received at least 1 dose. That 1 dose percentage has increased a lot in the last 2 to 3 weeks. It was sort of stuck at 2% for quite a while, and so now to see that jump to 5% is a positive sign. In Lamar County, they're now at 39% of their population is now fully vaccinated, with another 8% having received 1 dose. That 8% has grown a lot over the last 2 to 3 weeks. But one number that's concerning to us, particularly on the Forest County side, in Lamar County, 90% of their seniors, and again, seniors are one of those vulnerable populations, 90% of the people over the age of 65 have been vaccinated. In Forest County, that number is only at 62%. And that's a call to action to you who watch this briefing. Check with your family members, check with neighbors down the street, check with church members and other folks that you know, and ask them, have you received your vaccine? Can I help you get online or call in and set up an appointment to get that? Can I help you get there? It's important that we realize that 38% of our seniors in Forest County have not received a vaccine, that we do something about it. Our goals, and these have been our goals since spring of 2020, protect the vulnerable, prevent overrun of the healthcare system by slowing the spread, and prioritize public health while allowing the private sector to continue operating. The truth is that our focus must be on increasing vaccination numbers. That is the way, the long-term solution to getting out of this, whether it's the Delta variant or any other variant that happens from now on. We have to get more shots in arms. And when only 62% of your seniors in Forest County haven't received it, when your total population, only 30% in Forest County and mid-40% in Lamar County have gotten vaccinated, there's a lot of work to do. And I know that a lot of people have been maybe on the fence about getting their shot. And certainly we understand initial fears and questions. And certainly we understand there are people who are skeptical about COVID, because I read your comments on this briefing. But maybe now that you're seeing 110 people in the hospital, well over 90% of which are unvaccinated, and you're hearing stories of friends and neighbors and family members and people who are otherwise healthy and reasonably young who are having some severe outcomes or losing their lives to this disease, maybe you're ready to have that conversation with your doctor. And I encourage you to step away from Facebook when it comes to this issue and talk to your healthcare practitioner, your doctor, your nurse practitioner, and let them talk to you about the safety and efficacy of these vaccines, and hopefully we'll get you to take that step and go ahead and get that first dose. We had mask mandates for well over a year to keep us as safe as possible until a vaccine was widely available. We kept our mask mandate longer than most other cities in Mississippi to give everyone time to get their shot. It's now personal responsibility. Going back to mandates is not something that our healthcare institutions are recommending right now, because the focus has to be on getting people vaccinated. And we realize there are a lot of people on the fence, and we want to make sure that they have an opportunity to do that. Yes, you should wear a mask if you go into an indoor setting or if you're with other people. It's the safe thing to do. The CDC guidance says that. When I go out, I try to have my mask with me to keep myself safe, my family safe, and other people that I might interact with. But the sustainable long-term solution is increased vaccinations. That is the thing that is our pathway out of this. It is our pathway to stop the strain on our healthcare system and our healthcare workers. And that is where our focus will be over these next few weeks, while we're continuing to listen to our healthcare community, talking to Forest General and Merritt and Hattiesburg Clinic, and watching our data on a regular basis. Everyone agrees the main priority, while we encourage that good personal responsibility, that good behavior of wearing a mask, the focus has to be on getting people vaccinated, and we hope that you'll help us do that. One other thing that we encourage you to do is if you need to get tested, make sure you do that. Early detection matters, because you can get yourself isolated and you don't spread this. One statistic that Hattiesburg Clinic shared with us is that when somebody's getting the Delta variant, because it's so much more contagious, they're potentially spreading it to 8 other people without even knowing they're doing that. And so Monday through Friday, testing is available at the Forest County Health Department. You do have to make an appointment. They have rapid testing and PCR testing. You can do that by going to covidschedule.umc.edu. We also have free testing at the C.E. Boyd Community Center Wednesdays and Saturdays from 8 to noon. Those are PCR tests where you get the results between 24 and 36 hours, but there is no appointment necessary. And of course, both Merritt Health Wesley and Forest General and Hattiesburg Clinic have clinics that you can go to, as well as Semride, to get tests as well. But as we go into this week, and we've got some tough weeks ahead of us, it's important that we engage in good, personal, responsible behavior. Wash your hands. Take care of yourself. Wear a mask if you're around others. Get your vaccine, but most of all, be kind. We can turn this thing around, but it involves each of us doing our part. Stop politicizing this and just do what's in front of us. Do the right thing, and I encourage us all to do that.